Okay, so on to our next presenter. Oh, she's already here. She's like ahead of the game. I don't even really think she needs much introduction, but this is Dr. Linda Altenhoff, if you don't know who she is already. She is with the, well, I don't know if they're calling it the office anymore, but she's with Inspector General, and she's going to give us some very important information. This is something that I know has been requested, I think, over and over again, but it's always good to hear everything that we can know about it. So thank you, Linda.
Thank you very much. Appreciate the opportunity to be here and to see some familiar faces here within this room, and I'm sure there are some that are out on listening in remotely. As Dr. Lackaby said, we've had a lot of questions over the past few years about solicitation by Medicaid providers, and in my position with the Inspector General's office, it comes to our attention on almost a daily basis that this is occurring out among our colleagues, and so really wanted to revisit this once again with regards to what is allowed and what's not allowed. So, Medicaid defines a solicitation in the manner of offering to pay or agreeing to accept. So it's not only that somebody, a provider, is paying for it, but that there's an individual or a group of individuals who are willing to accept compensation either as cash, check, any sort of value that's given to them for securing a patient or having people come in to see those providers. And the fact of the matter is, and we do have on these slides so that if you want to go back and look at it, there are references to the Texas Administrative Code where this language exists based off of direction from the state legislature. So it really is targeting, for the purposes of Medicaid, those who are looking to solicit Medicaid recipients to their practice. And it's across all health care provider types. So it's not dental specific, but we are talking today, because of you being dentists and dental representatives, really focusing in on that. But I wanted to bring to your attention, it's not just a Medicaid requirement. This is through the Occupations Code as well, which allows us to be licensed as dental professionals in the state of Texas, where there is the prohibition of soliciting patients no matter what their payer source is. So this is not something specific to Medicaid, and I just wanted to make that clear. It is across the board, no matter what. You are not allowed to solicit patients to your practice by offering compensation in one form or another to an individual or group of individuals for that purpose. There are several other laws, though, that also play into this. We find it in the Medicaid rules. We find it within our several areas within the Texas Administrative Code, and it allows for sanctions or program violations to be put forward to individuals and practices who have violated these particular policies and these particular rules within the Medicaid program. So there are several assessments of penalties. There could be contract termination and exclusion from the Medicaid program, not only for the provider but for the provider group, should we be able to identify that this is occurring. State regulations, again, come into play with regards to the compensation or remuneration that is offered. So any inducement to encourage an individual to present to your office that will influence their decision regarding the selection of your practice or somebody within your practice to be their dental provider, to use the goods or services that you are offering to them under the Medicaid or any other Health and Human Services program, can result in a penalty to you. So please be aware of that. There are also federal regulations about this. So anybody who is proven guilty of soliciting patients within a state Medicaid program can also be affected on the federal side, which could mean that they would be excluded from participating in any federal programs at any state in which they might choose to go and practice in subsequent to the sanctions being placed upon them here in the state of Texas. So again, it's just a matter of offering or transferring any sort of compensation to an individual who's eligible for benefits under a state, Medicaid, or other health care program. So again, not specific and not limited only to Medicaid, which would likely influence that individual to select that provider or that type of service. So the Federal Inspector General's office can also come into play with regards to putting forward sanctions, putting forward exclusions and such for that particular provider or provider group. Here are some of the examples that we have seen over the years and decades. Canvassing of neighborhoods, we saw that back in the 1990s in the larger metropolitan areas across the state of Texas, where there were buses that were going out and vans going out to low-income housing areas, picking up children and taking them back to their offices, in which services were provided at that point in time, with the parents not being present, not being aware that this was going on. That led to the change in rules and laws here in the state of Texas, which requires the parental accompaniment for children under the age of 14 to be accompanied by a parent or guardian or otherwise authorized adult authorized by the parent to serve in that capacity for their child under the age of 14 and under. It also put into play the Medicaid rule associated with informed consent and written informed consent for the services that were going to be provided, including Texas Health Steps dental checkups. And again, this applies not only to dentists, but also to physicians, because unfortunately in the 1990s, we were seeing physician groups who were going out and soliciting patients within these same low-income areas of our major metropolitan cities and communities here within the state of Texas. We've also seen where providers are advertising free transportation, not only within their websites, but also within any materials that they may be sending out to neighborhoods where they know they're focusing in on those zip codes and those census tracts within the communities that are low income prevalent. So please be aware that that is not something that can be offered. There is medical transportation that is available through the Health and Human Services Commission Medicaid Medical Transportation Program, and that is what the recipients and beneficiaries of Medicaid services should be utilizing should they have a need for medical transportation services. We've also been seeing the prevalence of providers giving gift cards, offering school supplies, backpacks, other credits or incentives to the parents for bringing their children to the practices. We've heard of one recently where the parent, after being delayed, their children had not been seen, they've been in the waiting room for 2 to 3 hours, got up to leave to go home because the kids were tired and they were frustrated with what was going on. And the provider actually chased after them into the parking lot and offered them $40 apiece just to come back in to have their work done. So again, that is not allowed. And things are being watched. They are being reported by other dental providers within the community because of the fact that they are disillusioned by the fact that there are our professional colleagues who are resorting to these types of tactics in order to get patients within their practices. We do have laws that allow for the penalties to be assessed for solicitation. I mentioned that previously, but one of the things, for those of you who are not aware of it, those penalties can be quite extensive. It can be up to twice the amount paid as a result of a violation, up to $11,000 for each violation. And that violation is not per day, that is per individual. So if you had somebody who was out there who was soliciting and brought into your office 100 individuals that we could identify and prove that that was going on, that's a big chunk of change for you. So please be aware that these are pretty steep penalties on the state level, but there are also similar penalties on the federal level, and both could be assessed to a provider. We've been asked over the years what determines the amount of the penalties that can be assessed. And the Inspector General here within Texas, we look at a number of things, including the seriousness of the violation, whether that individual has been caught violating and soliciting previously and have been informed and educated about that, and the amount necessary to deter that person from committing future violations. Because if the dollar amount seems to be or accepted as just a process of doing business or a slap on the wrist the first time, or maybe the second time, the third time it will be significantly more than that. Are there any exceptions? And as to taking into account most rules and policies, there are exceptions. And we've had questions about this over the course of the last few years as well. The policies do not prohibit conducting a marketing campaign, but that marketing campaign must be to the general public, not to any particular, targeting any particular patient type. Providing token items such as toothbrushes that has your the name of your practice on it, maybe floss samples, goodie bags that you give out that has toothbrushes, toothpaste samples, floss, things of that nature, that is okay because they're already a patient of record. So that is fine. Providing complimentary refreshments. If you're at an informational meeting, maybe part of a group that's there, maybe it's a medical provider and perhaps a pharmacy, perhaps it's sponsored by your local community hospital, and you're just one of a group that's there, then it's okay to offer complimentary food and beverages. One of the things that becomes problematic is if you are sitting outside of a HHSC eligibility office and you have a tent set up and you're offering pizza and free soft drinks and popcorn and other tokens, where you're really soliciting only to those Medicaid and CHIP recipients who are coming out of that eligibility office and trying to get them to sign up with your practice, that is not allowed. Providing a value-added service, if the entity is a managed care organization, including a dental managed care organization, that is an exception to the solicitation rule. And other conduct that specifically is authorized under law, including conduct authorized by the federal safe harbor regulations. And again, if you are interested, you can look that up under this citation. We've had some questions about what's the difference between marketing and solicitation. Again, we have a couple of elements within the Texas Government Code, and I do want to point out a correction. The second reference here is actually Section 533.008. The marketing guidelines is where you would find that. But in essence, the law prohibits, and these are some examples, targeting of specific persons or specific groups, setting up marketing campaigns near an eligibility office, as I referenced a while ago, disseminating misleading information, which again is a violation of the Dental Practice Act here in the state of Texas, giving out misleading information or incorrect information, or encouraging a patient to select a particular plan or provider over another. That again is not allowed. We know that there are many of you, again, out there who are disenchanted with what you are seeing being done, maybe just down the road from where your practice is. You've been in practice for a number of years. You've worked hard to build up a good reputation. You're doing your marketing and such through word of mouth because of satisfied patients who are encouraging their friends and family members to come to your practice. But you're seeing other things that are going on, maybe just outside your door, or perhaps at a health fair that you've gone to, or perhaps even your family members have been approached by a marketer or a solicitor for another practice. What can you do? Well, you can call the IG's integrity hotline and file a complaint. You can do it anonymously. The more information that you provide, the more we can target specifically what's going on versus trying to figure it out just by being provided general information. You can also submit through the IG Secure website, and this is a HIPAA-compliant website. When you go into it, there is a form that you fill out. Again, you can do this anonymously, but any information that is provided to us, we do maintain your anonymity. Again, as much information as you can provide specific to the location, the time, the date, the type of material that perhaps was handed out. We've had some individuals who've been able to capture it through a video from their phones, or perhaps they had their cameras with them at that time, taking pictures, doing video streams. That can be uploaded to the IG website in filing a complaint. Again, giving us very specific information and evidence of what you observed or have been reported to us, and it gives our investigators just that much more of a heads up as to where to go and what to be looking for. What happens next? We get those complaints. The complaints come through, whether it is the toll-free line or through the website. They are triaged. They're identified, again, as to what's going on, how much information was provided, and such. We may have to close the complaint because of a lack of information. Therefore, as I said, information is critical. We may refer it to one of the dental managed care organizations or to TMHP for provider education. We may also refer it for a full investigation within the Inspector General's office or to another agency, including the FBI, the Health and Human Services Office of Inspector General at the federal level, perhaps even to local law enforcement. Solicitation is one of the many factors that are considered when determining the seriousness of the allegations against a provider and what action will be taken. So we may have a complaint from about a provider that we're investigating with regards to overtreatment, perhaps low quality treatment that's been provided. When we also get a complaint about solicitation or improper marketing that's going on, that is added onto and compounds and taken into account as we continue to work forward on that case and determine what action is warranted and what action we will take and move forward with. We do have a number of provider education efforts that are moving forward. This happens to be one of them, but we also are working through a number of venues in an effort to get the information out to our providers and colleagues. We do that through the TMHP banner messages and bulletin articles. The Texas Dental Association has been a great partner in putting forward through their newsletters information about Medicaid, not only policy changes and such, but also around solicitation. The Medicaid and CHIP website page that they have through the Texas Dental Association website is a very good source of information for providers and their practices and staff. The dental managed care organizations sponsor webinars and provide other information. So as you are participating or have staff participating in any of those opportunities, be sure and share that with the remainder of the staff within your offices, so that utilizing it as an in-service so that everybody is aware of what they can and cannot do. Presentations, we are doing them through the Texas Dental Association, the Texas Academy of General Dentistry, their annual meetings, and any of their sub-meetings that they have. We do trainings within the 3 Texas dental schools, not only with the senior dental students, but with the pediatric dental residents. And we have also partnered with Texas Health Steps through their dental forums to be able to provide information about solicitation and other policy and benefit issues and challenges that we are seeing as we move forward within the Inspector General's office. So with that, My contact information, many of you know how to reach out to me. Again, if you are wanting to file a complaint, the best place to do that is not by calling me, but by going in either through the toll-free line